South St. Petersburg Community Health Assessment Presentation. Historical overview of the community of South St. Petersburg. The boundaries include everything to the right of I-275 from I-375 down. The right border extends to the waterline. The bottom of the boundary from this area is the waterline as well. Founders of St. Pete. In 1875, General John Williams purchased 2,500 acres of land in the Tampa area. Little did he know it was going to become a beautiful city. Soon to follow, in 1888, Peter Demon started a train system that was routed to St. Petersburg. He decided to name the city after his hometown, St. Petersburg, Russia. St. Petersburg officially became a city in 1903. In the 1920s, the city became more populated with tourists and people from the Tampa area. In 1924, the Gandy Bridge was established connecting Tampa and St. Petersburg. The same year, St. Petersburg became Pinellas County's biggest city. The city became known for baseball and magnificent hotels. St. Pete also was home to the U.S. Coast Guard base. In the 60s, the principal marina, main library, Bayfront Center, and museums were a new staple to the city. In the most recent future, St. Petersburg has become one of the top destinations for fine arts. The downtown area has many upcoming revitalizations, including more downtown apartments and condos, shopping, and new and upcoming restaurants. Over 900 events bring 10 million people every year to St. Petersburg. Analysis of the structure of the community. St. Petersburg is the fifth most populous city in Florida. South St. Petersburg combines the amenities and variety that any large city has to offer, while providing a small-town neighborhood vibe. The city meets sustainable of characteristics for a community to thrive, including physical amenities such as parks and events. In addition, it offers cultural support and career opportunities.
South St. Pete have issues. There are 3 limbs still on roof, maybe from previous hurricane era, and some 3 limbs hanging on the power lines. Garbage piles on front steps that blow down the street and multiple bags sitting at the curb, indicating some sanitation issues. Cars properly parked and some not moving vehicle parked on their lawn. To continue about issues, there are ongoing constructions of big buildings downtown. Therefore, there are some streets and intersections that were closed. Small and local businesses are out of business. There are bicyclists seen on a busy street without a bike lane.
Almost 260,000 people call St. Petersburg home. Being known as a place to retire to, Florida has about 17.3% of citizens over 65, higher than St. Pete at 15.7% or nationally at 13%. The community, county, and state is just under the nation's 22.8% children and teens under 18. By population alone, being right on track with the nation, it's no wonder that St. Petersburg was named an All-American City in 1972 by the National Civic League. The median household income of St. Pete is $45,483. Nationwide, that's $53,842, so 15% lower than a national average. I guess we really are paid with sunshine. Seasonal population increases with the arrival of snowbirds in the fall and decreases in the spring. The sunshine does also bring tourists to our area with estimated spending of $4.65 billion. Tourism represents more than 100,000 jobs in the county. As of November for 2017, Visit St. Pete estimates the county collected a record $54.7 million in taxes. This reflects a 10% increase from last year.
Health-related resources for South St. Pete include 3 hospitals: St. Anthony's Hospital, Johns Hopkins All Children's Hospital, and Bayfront Medical Center. St. Anthony's Hospital is a Catholic hospital located near downtown St. Pete. St. Anthony's Hospital has 393 beds, providing a wide range of exceptional healthcare services to our community. Johns Hopkins All Children's Hospital is dedicated to providing resources to only children. Bayfront Medical Center is a for-profit facility with services that include a Level 2 trauma center, pediatric trauma services, critical care, emergency services, Bay flight, and open heart surgery. Urgent care in South St. Pete includes Signature Urgent Care. Signature Urgent Care is a walk-in medical clinic. No appointments are needed, and you can be seen by a doctor fast. They're open 7 days a week, including weekends, after hours, and holidays. Most insurances are accepted. They also offer a $75 doctor's visit if you have no insurance. Physicals, labs, IV fluids, x-ray, TB skin testing, and drug screenings are common services from this group. St. Petersburg also has a free health clinic that offers services free of charge or on a sliding scale based on income. In relation to Healthy People 2020, substance abuse, cigarette smoking, and obesity are all objectives of South St. Pete. According to PinellasCounty.org, someone dies of a drug overdose every 32 hours in Pinellas County. Substance abuse is a major issue in South St. Pete. Tobacco has a major impact on our community. Pinellas County is working with local groups to educate the community on reducing tobacco use and exposure. The mission of Tobacco Free Florida is to promote a tobacco-free environment. Good nutrition, physical activity, and a healthy weight are all critical aspects of a healthy life. Cardiovascular disease is a prevalent disease in our community that can be reduced by a healthy lifestyle.
Analysis of the environment. St. Petersburg offers more than 2,900 acres of parkland. Reducing chemicals such as pesticides, non-biodegradable objects like plastic cups, bottles, latex products, diapers, feminine hygiene products are an important part of keeping St. Pete clean. One way St. Pete aims to do this is through the Penny for Pinellas tax, which is a 1% tax paid by everyone who spends money in the county. This took effect in 1989 and was just approved for an extension until January of 2020.
Government and public policy. The St. Petersburg City Council has this program, Get in Touch, where every resident can send an email to their designated city councilor. Community meetings posted for the whole week with agenda. They have community calendar posted from February 1, 2018 till April 4, 2018. All residents that has computer access could view public meeting online. Budget. The City of St. Petersburg has different boards and committees assigned to discuss the issue in order to help and assist the community with their needs and concerns. The 2017 Public Policy Council focused on building and supporting the relationship between the community and the public sector. The purpose is to advocate for issues which affect the economic growth and community vitality of St. Petersburg and its members. The meeting is held every fourth Tuesday of the month at 7:30 a.m. The City Development Administration has the lowest funding resources that has only 3.1%. City Development Administration consists of 4 important departments: planning and economic, development, transportation and parking management, real estate and property management, and enterprise facilities. All these departments has one thing in common: to expand commerce and create more job opportunities for city residents. Therefore, to see an increase in rates means more job opportunities for the people in the community.
Community needs, problems, and diagnoses. The homeless population is very prevalent in South St. Pete. The community has taken efforts to decrease the large homeless population by creating emergency outreach centers that provide free food, beverages, and resources. St. Petersburg has a rule to leave no child left on the streets. Obesity is the leading cause of diabetes and cardiovascular disease. Many patients checking into hospitals are placed into these obese category. Many of these patients are uneducated on proper diet and health risk factors. St. Pete lacks resources to educate these people. Theft is the #1 crime committed in St. Petersburg. The average theft rate is higher in St. Petersburg than in Florida as a whole. Southern parts of St. Petersburg were found to have higher rates of crime than northern St. Pete. STD rates are the highest in St. Pete in all of Pinellas County cities. St. Pete offers free STD services, including testing and counseling. The elderly people make up the most part of the population in South St. Pete. Reliable health care, preventative classes, and education are important for this age group. The elderly population is the main age group of patients admitted to the hospital, and oftentimes hospital emergency rooms go and divert, closing their doors to the population. An expansion in hospital beds and more staff would benefit this community. St. Pete is a community of both wealthy and poor people. St. Petersburg lacks in quantity of affordable housing. Many homeless shelters will only house individual people and not families of 3 or more.
With the current flu outbreak, the CDC recommends use of antiviral treatment as soon as possible for high-risk members of the community. Flu shots are offered at no cost at the Department of Health. Health Department also offers HIV/AIDS clinics, help with the cost of AIDS drugs, STD clinics, and immunization programs. Links between infectious and chronic disease have been found, including 3 of the 6 major causes of cancer death. World Health Organization, together with other governments and charitable organizations, have the goal of ending cholera and other infectious diseases and improve immunization rates around the world. Click the picture above to watch a YouTube about the mission to end cholera.